Dr. P.T. Christine Pieton is on now. To participate, call 1-800-375-2872 or email askme@drptpodcast.com. This is Dr. P.T. Christine Pieton. Dr. P.T. Christine Pieton is on now. To participate, call 1.
Hello, everyone. I am your host, Dr. Christine Pieton, an orthopedic and pelvic health physical therapist. This show is for you to be able to call in and ask your questions about your body so that you can get real, actionable answers about how to navigate your symptoms, how to overcome them, and how to get back to moving in the ways that you enjoy. I know how hard it can be to sort of translate the body language, as I like to call it, in our body. What do these symptoms mean? Do I need to be paying attention to them? Is this something that's just going to hopefully magically go away on its own, and then it doesn't, and then you don't know what you should do? Call me. Ask me so I can give you some more specific advice about what you're doing, what you maybe should be doing, and other things you can consider to be able to improve and level up your health. So give me a call here at 1-800-375-2872. Again, that's 1-800-375-2872. And just like I tell my patients, nothing is TMI here on this show. Our pelvic health and your overall body health are all important. I get asked all kinds of very intimate questions being a pelvic health PT, so nothing is off limits or scary. Give me a call. Ask it here so we can unpack it together. So I'm going to be answering our first call because we've already got some callers that are joining here. And then I'm also going to be answering the $1 million question that I get asked as a pelvic floor PT on the daily, which is, should I be doing Kegels? And you might be surprised at what my answer is going to be. So stick around and or give us a call here again at 1-800-375-2872. So we're going to dive into our first call here. Pat, welcome to the show. Thank you for calling. What's your question today?
Thank you. So several years ago, I had a hysterectomy. Mm-hmm. And, of course, the uterus is holding up the bladder. And as the years have gone by, the bladder keeps falling. And so I went into a doctor and got, I'm not sure if I'm saying it right, a pessary.
You said it correctly. Right? A pessary, yes. Yeah.
Yeah. So I have been using that, but it seems to be getting worse. So I went to a specialist about maybe having surgery or a sling.
Okay.
And it sounds like it's very, very major. Now they go do an incision through your stomach and then use a mesh sling, and the recovery is like 4 months, and it sounds really major. And I just wondered if there aren't some other options.
Pat, I'm so glad you're asking this question. So I will be totally honest here. My first question is going to be, have you had a pelvic floor PT on your team to also discuss and evaluate some of these things in addition to the other physicians that are on the team? First question.
No, I haven't. I wasn't sure where to turn or who to go to. Or,
yeah, absolutely.
What my options are.
Totally. So a couple of things here. Like you mentioned, when we have a hysterectomy, we are removing, an internal organ, the uterus. And then sometimes that can include fallopian tubes and our ovaries. Sometimes they keep the ovaries and the fallopian tubes. It kind of depends on what was going on in that process. But basically, we have suspension and support ligaments that attach to our internal organs, like the bladder and the uterus and the rectum, to help keep them suspended in our abdomen. And then support underneath that includes the pelvic floor. So we can use a pessary. For those of you who don't know, that is a medical device that is inserted inside of the vaginal canal, and it is temporary. You put it in, you remove it out. It's not a surgical tool, but it is a medical grade, usually plastic or silicone. They come in a variety of different shapes and sizes to provide internal support to kind of hold up those other organs like the bladder, the uterus, the rectum, okay? So Pat, like you mentioned, a pessary is something that it sounds like you've been using, but correct me if I'm wrong, that's not feeling helpful anymore. Is that correct?
Yeah, I just feel like I'm getting leakage again, and
Yeah.
It's something you have to take out and clean every week and put in, and
Absolutely.
I don't know.
There's some other steps involved, right? So before I jump to any type of surgery, this would be for you or for any of my patients when I'm being asked this question in my office. I always say, hey, what are your goals, right? And have we exhausted all of the conservative options before we discuss a more serious surgical intervention? I'm not against surgery, but I'm against going into surgery without having enough information to decide, is that really what we want to do? And asking your surgeon in that case, hey, these are my goals. This is what a successful outcome would look like to me. Does this surgery achieve that? Asking the surgeon, what is your success rate in performing this surgery based on the goals that I just asked? A lot of times, consulting with a pelvic floor PT to work on pelvic floor strengthening before we go into a surgery would be my number one thing for anyone who's considering a major pelvic surgery. Unfortunately, that's not usually recommended. Usually you as the individual have to be proactive in asking about that.
Is it possible, though, with just exercise to be able to hold up the bladder?
So typically what I would say is there's a couple of things here. So we have the support that might be compromised in terms of those ligaments and things. Can PT change that? No. But can we work on sometimes the strength underneath, and can that mitigate some of the symptoms that our patients are having? Yeah, absolutely. Can it improve those situations? Yes, often. And then sometimes we also need to be refitted for another pessary or explore other types of pessaries because our body changes over time. And so the sizing of those things sometimes needs to be changed over time as well. Some pelvic floor PTs are trained in knowing how to fit and size pessaries. Some are not. And then the other provider that's usually trained in this is a urogynecologist and then sometimes urologists. So it depends. You might have to kind of do a little bit of research in your area to see who might be able to help with those things. But a pelvic floor PT can at least also guide and say, hey, yes, I do think this could be possible and help you with a possible referral and things like that. I'm often doing that with patients in my office as well. And then two, doing pelvic floor PT and seeing if that can improve your symptoms will give you better clarity around, do I want to proceed with the surgery, or was I able to improve my symptoms enough where I don't feel like I need the surgery? So either way, helpful to be able to give you better confirmation about what you want to do next.
Can you explain? You said I didn't know there were several different kind of pessaries. Can you go into that a little more?
Absolutely. So there are probably a dozen different types. There's kind of a ring, a cube, a Gellhorn. There's all kinds of different types. And so the person who's fitting you for the pessary and based on your symptoms is better trained to know what type of pessary would be ideal for you and your symptoms and your anatomy. So these are sometimes other questions where I'll have my patients say, hey, I've been using this type of pessary. It's not really working for me anymore. I'll refer them to my providers who do fit for pessaries. Sometimes they need a different size of the same type, and sometimes they need to try a completely different type of pessary. So that's outside of my direct wheelhouse since I'm not trained to fit them or to, be able to make those recommendations, but I have other providers in my circle that I refer to be able to help with that.
So would you say a gynecologist would be the best kind of doctor to go to for that then?
So,
or a urologist? Or
what I recommend, I'll give you the following of who can be possible. Unfortunately, not all of them are automatically trained in this. They do advanced specialties to be able to know how to fit them. So just because someone is a gynecologist doesn't mean they're always trained in fitting a pessary. But yes, the providers that typically have a higher rate of knowing how to do this include the following: gynecology, urogynecology, urology, and then pelvic floor physical therapists. Yes.
Okay, so there's a urogynecologist. I didn't know that.
Yeah.
Urogynecology?
Yes.
Oh. Is that probably who I should see then if I think I need a different fit?
I would highly recommend starting there. And when you call the office, you can ask them, does this provider fit pessaries and things like that? The office should be able to tell you that. And then you'll know who to schedule with.
Okay.
Yep, absolutely.
Urogynecology, okay.
Yes.
Well, maybe that's the place for me to start then, huh?
I think that would be a helpful place to start, and then you'll be able to get some additional insight there. And then you can also Google pelvic floor physical therapy near me and see if you can find a pelvic floor near you or pelvic floor PT near you to also be able to be on your team to help collaborate with you as you're navigating next steps.
With the doctor. Okay.
Yep.
That's very helpful. I'm glad I called and spoke with you.
I'm so glad. You're so welcome. Take care, Pat. What Pat just asked about is something that I get asked all the time in my office. And hysterectomies are one of the top surgeries that women go through in our second half of life. The last time I remember checking the statistic in about the last, year or so, it said something like it is in the top 3 procedures done in terms of surgical procedures for women. Hysterectomies deserve to have pelvic floor physical therapy. We remove an entire organ out of the body, and it impacts a lot of the tissues that surround that organ, as well as impacts the pelvic floor and strength throughout the pelvic floor. So if someone is considering a hysterectomy or it's being recommended to you for your health, it's important to advocate and ask to have a pelvic floor physical therapy consult so that you can also have someone like us that can help support you in terms of prehab, I call that strengthening before you go into surgery, and also having a rehab provider on your team after your surgery, post-operatively, to be able to help you maintain and support your pelvic health long-term, not just see if it'll get better after that. When people have hysterectomies and don't get the recommendation to have physical therapy afterwards, there's a significant increase in pelvic floor and pelvic health symptoms that often result within the years after that. So advocate for a pelvic floor physical therapy referral so that you can have someone like us on your team so you don't have to just deal with those things. You can get better information out of the gate and know how you want to support yourself better. All right? So before I jump into answering the important question that I said in the beginning of the show, should you be doing Kegels? I'm going to first just remind everybody to feel free to call in, ask your questions here at 1-800-375-2872. Again, that's 1-800-375-2872. So Kegels are just one way to strengthen your pelvic floor, but I'm going to tell you a little secret here. They're not my absolute favorite way to do this. And I know that that's going to sound like crazy making coming from a pelvic floor PT, but hear me out, okay? So the analogy that I like to give to my patients first is saying, hey, do we even know how to do a Kegel? Most people are never confident about, am I doing it right? And then when I ask, hey, did the person who told you to do your Kegels, which usually was another medical provider, I said, hey, did they bother to teach you how to do the Kegel, or did they just tell you that you should do it? In my almost 12 years now of practicing as a pelvic floor PT, I have not had one patient yet say, yep, that doctor definitely taught me how to do it and told me that I should just do Kegels and it's not really working and that's why I'm here. It's usually the opposite. No one told me. Yes, I was told to do 100 of them a day. I can't even make this stuff up. These are the things that patients tell me they were told. And my pelvic floor symptoms are not getting better. What gives? Okay. Unfortunately, Kegels have been the only solution given to people if they have a pelvic floor problem, or we assume that Kegels are the only thing that we need to do to fix a pelvic floor problem. The pelvic floor is a lot more sophisticated than that. If it was just needing to squeeze and we were done, it would make my job a million times easier. But unfortunately, that is not the case. So first and foremost, yes, Kegels can be a way to strengthen your pelvic floor, but it is not the end-all be-all. Number 2, your pelvic floor works on a team. So here's the analogy I give my patients. If you have the MVP of a soccer team, I'm going to use Mia Hamm as the example. And Mia Hamm is told to show up to all the practices, do all of her training and her workouts, be ready for all of the games. But the rest of her teammates are not required to show up for practice, are not required to do their work. How do we expect the team to perform on game day? Not that great, right? But then Mia Hamm gets the blame that the team didn't win. So if you're just doing Kegels but we're not strengthening all the muscles around your pelvis, the team, your pelvic floor's squad around the pelvis, we can't expect our pelvic floor to have the best strength possible. The other teammates that are really important here are your abdominal muscles, your spinal muscles, and your breathing muscles, okay? That main diaphragm and the base of your rib cage, those are the other really important players on the team. So if there is weakness or not enough endurance in these muscles that I just mentioned, it doesn't matter how many Kegels you're doing well, your pelvic floor is still going to get asked to do more work than it has the capacity for because the rest of the team is underperforming. We need full body strength in order for your pelvic floor to be able to have its best chance of being strong. And in order to do that, we need to be strengthening our whole body. Now, I know that might sound a little overwhelming as I mention this, but here's the good news. Your pelvic floor and your hips work really well together. As you start to strengthen your hips, you're going to start to see some of those improvements in your pelvic floor too. It doesn't mean that sometimes doing a little bit of Kegel work in isolation along then with hip muscles and core work and all of those things is going to be most helpful. But just doing Kegels alone is not going to give you the outcome that you want. And that really blows many of my patients' minds as I bring that to their attention and helping them to understand why their exercises for me are going to involve more than just Kegels. Okay? Now, when we're talking about Kegels, once again, how are you doing them? So research shows that about 80% of people do Kegels wrong. And I would actually agree with that based on when I'm doing assessments with my patients and asking them to perform a Kegel when I'm doing an internal pelvic floor exam, and I am assessing how well did their pelvic floor contract and then lengthen. The vast majority of my patients also are not doing that well when we first meet. Many of them are using a bunch of other muscles in their body, like squeezing their butt, squeezing their inner thighs, clenching their jaw, lifting their shoulders, holding their breath, instead of their pelvic floor actually doing the contraction and the lengthening. Okay? So we might be doing a bunch of Kegels, but are you doing them with the muscle that is intended, or are we substituting a bunch of other muscles? A lot of people that are having difficulty are substituting with those other muscles. Okay? The other piece that I want to bring up here, there's a really big misconception with Kegels that it's just about the squeeze. The squeeze is only half of it. So if we're only good at squeezing, but we don't know how to control re-lengthening your pelvic floor, then you are only improving 50% of its capacity. I'm going to say that one more time because this is another one that really blows my patients' minds. A Kegel needs to involve a contraction and a shortening and a lifting of that pelvic floor. And it also needs to involve a lengthening of that pelvic floor, because a strong muscle anywhere in the body is one that can fully contract and fully lengthen again. If it can't do both, then we don't have full strength yet. And a lot of people with pelvic floor challenges are usually stuck in one or both of those phases. They're really good at just 50% of it. We got to have 100% to have full capacity. And then we got to have a strong squat around it. Remember, hips, abdominal muscles, spinal muscles, and our diaphragm. All right? So we're going to take a quick break here. Please give us a call. Ask your questions. I want to help you be able to better decode the messages that your body is trying to tell you about those aches, pains, and pelvic floor symptoms. Give us a call at 1-800-375-2872. And when I come back, I'm going to continue to expand on how to actually do a Kegel for those of you who are curious. And also, what other exercises do I commonly recommend to be able to strengthen your pelvic floor outside of Kegels? As a doctor of physical therapy, I'm all about optimizing health and wellness. We start to lose collagen, the most abundant protein in our bodies, when we're in our 20s. And that really ramps up after 40. Native path collagen can help replenish this essential protein needed for healthy bones, joints, skin, hair, nails, and digestion. Native path is packed with the types of collagen your body needs most. With just 2 scoops a day, you'll get 18 grams of protein. It's completely flavorless and easy to mix into any drink. There are no fillers or additives, and Native Path is a third-party tested for purity. Get to getnativepath.com/DrPT for a special bundle deal at a fraction of the retail price, plus free shipping. That's getnativepath.com/DrPT. Feel better, look younger, and start your transformation today. I do not need a miracle in a bottle, just a product that actually delivers on its claims. And that's why I'm excited about Vibriant's Super C Serum. Super C Serum is designed to replace all the things people my age and older start adding to their daily routines, like day creams, eye creams, night creams, neck creams, wrinkle creams, and the dark spot reducers. It's created with the highest quality vitamin C on the market, plus hyaluronic acid, vitamin B5, vitamin E, and other trademark ingredients. It's gentle enough for sensitive skin, but guaranteed to deliver noticeable results, or they'll give you a refund within the first year. Simplify your skincare routine with Vibriant's Super C Serum. Go to Vibriant.com/DrPT to save up to 37% off, plus get free shipping. That's VIBRIANCE.com/DRPT. Vibriance.com/DRPT to save up to 37% off and get free shipping today.
This is Dr. PT Christine Pieton. To participate, call 1-800-375-2872 or email askme@drptpodcast.com. This is Dr. PT Christine.
Welcome back, everybody. My name is Dr. Christine Pieton. I'm an orthopedic and pelvic health physical therapist if you are just joining us, and this is the Dr. PT podcast show. For those of you who are live on our YouTube stream, if you have a question, feel free to throw it in the text box down below, and our team will make sure that it gets to me so I can also answer your question there. And also, once again, feel free to give us a call at 1-800-375-2872. I would love to talk to you and be able to help better your knowledge about your body so that you know how to better listen and take different action for your health. So we were just speaking before the break about should everybody be doing Kegels? And the short is not everybody needs to be doing Kegels. And also, if you are doing them, are we doing them correctly? Because if we're not doing them correctly, that's not going to help your pelvic floor, and it can actually increase pelvic floor symptoms if we're not doing them correctly. So right now, we're going to unpack how do you even do a freaking Kegel? Let's clear this up so that everybody can feel more confident about, am I doing it right or not? And this is going to be similar for the guys and girls here, okay? Yes, some of the external plumbing, as I like to call it, is different, but the internal structure of the pelvic floor actually shares a lot of similarities. So the cues that we use as pelvic floor PTs to help people know how to do a Kegel and how to do it correctly are actually very similar. So feel free to listen here regardless. So I'm going to use my pelvic model here once again to kind of give a visual. So if you're listening to this in just an audio form, I encourage you at some point to either Google a pelvic floor image so you can kind of get an image in your head of what it looks like, or find our live stream here on our YouTube channel so that you can actually see the visual. So as I'm looking down inside of the pelvic bowl, let's orient ourselves. So we have the pubic bone in the front, which is where your belt buckle is. You have your spine on the back, and then each half of the pelvis. And then underneath the pelvis, I want you to orient yourself to your 2 sit bones. So when you're sitting in a chair, kind of those 2 bony landmarks that you can feel making contact with the seat are your sit bones. Medically, we call them the ischial tuberosity, which is total mouthful. So your sit bones, okay? Now, from your 2 sit bones, remember you have your belt buckle, which is where the pubic bone is, and then we also have the tailbone, okay, which is at the base underneath the spine. So when I'm helping patients to understand how the heck do you do a Kegel, all right, I'm using these landmarks here. So first, I want you to take a slow, deep breath in through your nose, and I want you to fill your torso with air and notice what happens to your pelvic floor. Ideally, it should gently lengthen, meaning you should feel a little bit of widening happen between your two sits bones. I'm going to encourage you to do this in a seated position if you're not already, just to be able to follow along here. I should have pointed that out before I started. So as you're sitting here, that inhale is increasing length through your abdomen, length through your abdominal muscles, your spinal muscles, and then all the way down, ideally, to cue your pelvic floor to lengthen as well. Now, as we exhale, imagine like you're blowing candles out. Give it a little bit of energy. I want you to exhale and think about your two sit bones here as if you're trying to gently draw them towards center. And then up towards your pubic bone, and keep exhaling, feeling your abdominals gently contract as you blow the rest of the air out. Okay? So I'm going to cue this again because we all need a little bit of practice. So you're going to take your deep breath in, try to let your shoulders stay relaxed. That inhale should come from your diaphragm, the base of your rib cage. We want it to gently expand 360 degrees. Think east and west. Okay? As your torso fills, that's increasing the pressure inside of your abdominal region, and that's gently inviting your pelvic floor to lengthen. So that space between your two sits bones should feel like it widens. Now as you exhale, those two sit bones should feel like they're gently coming together, and you kind of feel that change in that pressure in your abdomen decreasing as you blow the air out. That's helping to release that pressure. So a Kegel is more than just your pelvic floor. Ideally, it needs to be paired with your breathing to be able to help sequence this entire team together. Remember that soccer team analogy I mentioned earlier. We want everybody on the team to be practicing together so that they can be strong together. Breathing, I argue, is my favorite exercise to start teaching people how to find their pelvic floor and also how to integrate it together. What your pelvic floor is doing while you breathe is a version of a Kegel. Now, if you were just breathing and you're like, oh my gosh, I didn't feel anything happen at my pelvic floor, that's a sign that we need to work on that. If you felt like it was really hard to feel your pelvic floor move during the inhale or the exhale, then that's part of your Kegel that you're going to want to practice and work on. And a lot of people, honestly, have more difficulty learning how to lengthen their pelvic floor, which is what's happening on the inhale. Most people are more familiar with the contraction and the shortening. Learning how to lengthen your pelvic floor is a really important practice, and this comes with your breath and working on your breathing mechanics to help improve this, not just trying to squeeze your pelvic floor. Okay? Other cues that I will give patients if they're struggling with this. As you take your inhale in, can you think about breathing all the way down to your tailbone? Can you try to soften your pelvic floor down into the chair? Can you help it drop down and make contact with the seat? And then as you exhale, if you're not feeling anything move, then you want to manually help that pelvic floor. Can you start to draw your two sits bones together and then continue to think about that pelvic floor lifting up towards your head as you blow your air out? Another cue sometimes for this is, can you think about like you're trying to stop the flow of urine, right? So as we inhale, we're letting everything expand. As you exhale, can you pretend like you're trying to stop the flow of urine or trying to prevent having, passing of gas, those types of things. You can kind of feel that pelvic floor rebound and contract. If you're still having difficulty with this, then you can try these things lying on your back. Sometimes being in a more reclined position at first makes it easier for people to be able to work on this, and then coming into sitting and then ultimately standing. And if you would like a tutorial to practice this a little bit more, I encourage you to check out the longer form videos that I have on my YouTube channel that go through this exactly. So there are lots of examples there that you can continue to build upon. But once again, the big takeaway I want you to leave with here is that your Kegel is not just a squeeze. It is a contraction or the squeeze that most people think about, plus the lengthening. And also, in order to best strengthen our pelvic floor while we're doing Kegel work, we need to be incorporating breath work. Your breath is essential because your diaphragm, that main breathing muscle in the base of your rib cage, works directly with your pelvic floor. Your diaphragm is the conductor of that team. It is helping to cue your pelvic floor how to respond. So if you want a really strong pelvic floor, you need to work on your breathing mechanics and your diaphragm so that they can integrate together. All right? So I'm going to remind you to give me a call with your pelvic health or your orthopedic questions. Maybe you got a shoulder thing. Maybe you got a low back thing that's been going on. Something down at your foot. I do it all. Give me a call here at 1-800-375-2872. And then, of course, pelvic floor questions are always welcome as well. Again, if you are having any questions that you want to throw into the chat box on the YouTube live stream, feel free to drop it there so that my team can also get it to me so I can ask it up here. And if you feel too embarrassed to ask on the show or in the text box, you can also send me an email at askme@drptpodcast.com. And speaking of emails, I'm going to dive in here and I'm going to answer a few of the emails that I've received over the last few weeks. And I apologize if I don't get to all of your questions every week. I've been loving them and know that I'm saving them to be able to use on future shows. So if you don't hear me share your question here today, know that I haven't forgotten about it. Keep sending them. So Sally wrote in asking about some of her symptoms related to overactive bladder. This is a really common thing that I see in my office all the time. Her question is kind of a few parts. So one, she's asking about a common medication that is often recommended for people with overactive bladder called Vesicare. And she asked, does it cause dementia? She also asked how long would be considered too long to be on that medication for that risk factor. And how many times a week do women need to be doing Kegel exercises? Okay, so I will share and be totally honest here. Medications are not my direct wheelhouse as a physical therapist. However, I would encourage you to have a conversation with your doctor who's prescribing that medication to be able to better discuss what is ideal for you and your health history and things. Yes, Vesicare for older adults who are on it for longer than a year is what the research shows can have an increased risk for neurological conditions and dementia. So be sure to have a conversation with your provider about these things. There are other medications that can be explored. And I always say, what is causing the overactive bladder? Are we just giving a medication to cover the symptom, or are we actually addressing the root cause? So this is where I go, hey, what's the root cause of the overactive bladder? And this is something that really surprises my patients when I'm trying to be a detective with them and asking more about their symptoms, because overactive bladder can actually be caused by a number of things, which I'm going to unpack here. So is it actually a bladder issue? Meaning, do we have something going on inside of the lining of the bladder that is being irritated that might mean that we need to consider different dietary things that can cause further irritation? Usually it's all the things that people like to eat and drink, like caffeinated things, alcohol, sugar, acidic foods, as just a few examples. So carbonated beverages are another one that I'm often asking patients about. If we're consuming a lot of those things a lot of the day, can that cause some irritation to the bladder lining, and can that cause overactive bladder? So again, I'm being a detective and asking about those things with them. Okay? Other things, could we have a pelvic floor that's not strong enough? Yeah. And so as your bladder is filling throughout the day, if we don't have the counter support of that pelvic floor to be able to hold until you can make it to the bathroom, your body's going to let you know. And it's going to feel like you have to go to the bathroom a lot through the day because it can't hold a large volume for very long. So is it a pelvic floor muscle issue? And being able to figure that out. Can it also be something related to a prolapse? So we haven't really unpacked this diagnosis a whole lot yet on the show, but prolapse is basically a medical term that can apply to the bladder, the uterus, or the rectum. And it means that one or more of those organs is actually kind of descending and collapsing into the vaginal canal. And so this can actually sometimes cause overactive symptoms and things because we don't have enough support for the bladder itself. that can start to kind of create increased urgency, frequency trips to the bathroom. And so looking at that and seeing if that's a driver. And then again, Pete, this is one that really shocks people. If someone has constipation, kind of chronic constipation, or more chronic kind of irritable bowel, looser stool things, this can actually cause overactive bladder. Hear me out. So if your pelvic floor is having to work overtime to support your bowel health, it's going to get a lot tighter and more fatigued in towards the back portion of the pelvic floor, because it's like, hey, I have a bigger bowel movement that I'm needing to hold and support until you can get to the bathroom. Or looser stools make your pelvic floor have to work harder, because that looser consistency means that that pelvic floor needs to contract more so that you don't have a leaking episode. All right, so the pelvic floor is constantly assessing and adjusting to what we need. So if that's happening on the back portion of the pelvic floor, then the support underneath the bladder is not going to have the same support, right? So let's use the model again. If I'm holding here, that back hole back here is the rectum. Your bladder is going to sit right in front of it. If there's a lot more tension in the back portion of that pelvic floor, then the fibers in the front of the pelvic floor have to yield and give, because we need more support back there. So if they're more extended in the front and you have a fuller bladder there, it's not going to be able to hold that volume as well, and you're going to start to get overactive symptoms and or leaking. So these are other questions I'm asking my patients about their bowel health related to, is that a driver of their urinary symptom health? Okay, so PTs are movement detectives, and like I like to say, we are kind of the body language translator. What does your symptom tell me? I need to ask more questions instead of just labeling it with a medication to cover up or mask the symptom, right? So, Sally, to answer your question, I am more curious of what is driving your overactive bladder. And if you haven't worked with a pelvic floor physical therapist yet, I would highly recommend that, so that we can figure out what's actually driving it, because you can see now we need to do some more detective work. All right. And then to answer your question, how many times a week do women need to do Kegel exercises? All right. There is no magic number. And once again, I don't know if it's actually a pelvic floor strength issue or not when we're having overactive bladder. That's not just for you, that's for any of my patients. So Kegels can be a piece if we actually have a pelvic floor weakness. And then I'm still looking and assessing, what's the strength of my patient's hips in that situation? What about their abdominal muscles? What about their spinal muscles? And they're getting exercises from me that are addressing those things, in addition to their pelvic floor, if that's something that we actually need to be addressing. Okay. The other thing here too is hormones can play a role in overactive bladder as well. So when we have a reduction in estrogen over the course of our lifetime that starts to increase as we go through the second half of life for us ladies, this is also going to affect the bladder. And for some people, it will affect people more than others. So the flexibility of the bladder lining can start to decrease as we have a drop in estrogen. So if it can't stretch as well, then as it fills with urine, the body is going to start to signal that you need to go to the bathroom more frequently, because it's not able to fill largely as comfortably. So sometimes there's a hormonal component that also needs to be addressed, in addition to all of the other things that I mentioned. Now, to be clear, hormone changes are not the only driver, but sometimes they can be a piece of the puzzle. And so I'm discussing that with patients depending on their health history, how many birthdays we've had, those different things, in addition to all of the other questions that I asked and mentioned in terms of what could be causing overactive bladder symptoms. So Sally, I hope that kind of helps to give you a little bit more insight, and also to help more of you that might be listening, that a symptom doesn't tell me what the driver is yet. It just tells me that I need to keep getting curious and keep asking more questions, because the same symptom doesn't always have the same root cause. Okay. So again, reminding you all to give us a call here if you have any questions. The phone number is 1-800-375-2872. Once again, 1-800-375-2872. And we're going to take a quick break here. And when I come back, I'm going to answer a few more of the emails that I've gotten to be able to further unpack some really awesome pelvic health questions that I think will be really helpful for other people listening as well. Catch you when we come back. I do not need a miracle in a bottle, just a product that actually delivers on its claims. And that's why I'm excited about Vibriant's Super C Serum. Super C Serum is designed to replace all the things people my age and older start adding to their daily routines, like day creams, eye creams, night creams, neck creams, wrinkle creams, and the dark spot reducers. It's created with the highest quality vitamin C on the market, plus hyaluronic acid, vitamin B5, vitamin E, and other trademark ingredients. It's gentle enough for sensitive skin, but guaranteed to deliver noticeable results, or they'll give you a refund within the first year. Simplify your skincare routine with Vibriant's Super C Serum. Go to Vibriance.com/DrPT to save up to 37% off, plus get free shipping. That's VIBRIANCE.com/DRPT. Vibriance.com/DRPT to save up to 37% off and get free shipping today. As a doctor of physical therapy, I'm all about optimizing health and wellness. We start to lose collagen, the most abundant protein in our bodies, when we're in our 20s. And that really ramps up after 40. Native Path Collagen can help replenish this essential protein needed for healthy bones, joints, skin, hair, nails, and digestion. Native Path is packed with the types of collagen your body needs most. With just 2 scoops a day, you'll get 18 grams of protein. It's completely flavorless and easy to mix into any drink. There are no fillers or additives, and Native Path is a third-party tested for purity. Get to getnativepath.com/DrPT for a special bundle deal at a fraction of the retail price, plus free shipping. That's getnativepath.com/DRPT. Feel better, look younger, and start your transformation today.
This is Dr. PT Christine Pieton. To participate, call 1-800-375-2872 or email askme@drptpodcast.com.
Welcome back, everyone, to the Dr. PT podcast. I'm your host, Dr. Christine Pieton, orthopedic and pelvic health physical therapist. Thank you to those who have already called in, and for some of the other brave people who have asked their questions down in the chat here on our live stream. So I'm going to dive into a few of the live stream questions while I continue to encourage people to still give us a call at 1-800-375-2872. So one of the questions that we had here in the chat is for someone who is 9 months pregnant. Congratulations, you're almost there. Any advice on sleeping positions if lying down is not an option due to a high level of discomfort, pain around the lower ribs, and stretch type pain? So yes, this is such a common challenge as you're getting further along in your pregnancy, and what I'm going to say is basically getting close to the finish line. So a couple of things that I often am recommending for patients is a wedge pillow that can kind of help to create an incline for you to be able to sort of offload some of the discomfort that many people feel as they're getting to that point in their pregnancy. Also, different types of pillow support, not just between the knees, but between the knees and the feet. I feel like a lot of people sometimes just put a pillow between their knees, but actually helping to level out the alignment between the knees and between kind of the ankles or your lower shins can actually create a lot more support and comfort. And then the other piece that I'm often encouraging patients to explore and play with is either with a pillow or a towel roll or whatnot, and actually placing it more along the kind of waist space of your body. So think like where the rib cage ends and before the pelvis meets. So that kind of rib cage to pelvis zone right in between there, often putting a little bit of support there when you're on your side, different things like that can go a long way in terms of comfort. So explore a few of those things, and hopefully that'll help you in kind of the next few days to weeks here, since you said you're 9 months pregnant. So you're getting really close, and I hope that you have a really supportive birth. So I'm going to jump forward here. We have another call. Kristen. Hi, Kristen. Thanks for giving us a call. What's your question?
What's up? Hi. I was just calling. I had a question. It might be a little bit different, or if it's just something you deal with.
Go for it.
I know I've talked to you online a little bit about this, but I've been dealing with this bloating, and like a lot of abdominal distension. When I look back, it did actually come on after a pelvic floor flare-up, and I have been to pelvic floor PT, and I've been working with a functional dietitian now for like 6 months. And I just, like, it's been a throw up of, like, is it more gut? Is it more pelvic floor? And I've been thinking of going back to pelvic floor PT. And I also saw something on Facebook the other day, and I was like, this sounds like the most describing my symptoms right now. It was, like, pelvic floor related. And I was like, okay, maybe I need to go back to pelvic floor for this. But I guess I could describe my symptoms, but also this diagnosis that I saw was like, this sounds like exactly what I'm having going on right now.
Yeah. Share
a
little bit more. Yeah. What are you thinking in terms of the information you found and kind of the diagnosis, if you will, that you're working with right now?
Yeah, I'll tell you the diagnosis, and then I guess at the end of the day, diagnosis doesn't necessarily matter, right?
Good. This is a good point, but yes, pointing us in some directions. It's data, but yes, good point.
I screenshotted it, the actual name, but maybe you'll know. I think it's more rare, so I don't know, but it was like something with an A, like I don't remember, something dysmorphic, like something to the dysmorphic. That's what it sounded like, and it was basically the person was describing it's like your internal organs like get shifted around, and then it causes a ton of distension of your pelvis. Because I've been like, okay, is it like an endo thing? Is it like I've gone down like lots of routes, or is it literally just an IBS thing? Anyways, I saw this, that everything they were saying about this diagnosis, I was like, that sounds like exactly. It's not a ton of pain, it's just like a ton of pressure and a ton of distension, and like I eat really healthy. Like it doesn't seem to add up, but anyways, I could definitely go into more symptoms too, but since I saw that the other day, I was like, maybe I will just ask you.
Yeah. So you're always welcome to kind of add to the discussion, but what I'm going to just reflect back to you is, sort of saying, hey, we're having a significant amount of bloating that we're noticing kind of throughout the month, and trying to figure out, is this more gut related or is this pelvic floor related? Does that sound like a helpful summary of sort of what we're working with right now?
Yeah. When I went into pelvic floor therapy, she found a lot of tightness. She's like, you just have so much tightness in like all the structures, right?
Yeah.
But she thought it might still be somewhat gut related, so I went back the gut related route. But I'm still not really finding really that much of the bloating. So
Yeah, so the bloating, just to kind of share for you, Kristen, as well as just general audience. So if we're having a lot of abdominal kind of, like bloating, distension, those types of things, that still deserves to be looked at from kind of an internal, GI system standpoint, because something there is either inflammatory / kind of allergy, food sensitivity, those different things. It also makes me suspicious of ruling in and exploring hormone health as well, because sometimes that can be a driver, because our hormones also play a role in GI function and GI motility and all of those different things as well. If we're having a lot of increased kind of bloating and that type of abdominal pressure that causes, the body responds by, asking the pelvic floor basically to have to work harder to counteract that increase in pressure in the torso. So we're going to usually have a lot more tightness through that pelvic floor. That's usually more of a secondary result rather than the primary issue driving the symptoms, right? Not to say that pelvic floor PT can't be helpful as an adjunct to be supporting the things that are going on, but just to kind of say, hey, I'm often counseling patients and saying we need both specialists on your team to be supporting these things. The other part too that I'm always kind of considering and noticing with patients too, even if we are eating really healthily, I still ask my patients to kind of do what's called a food diary and then a bladder and a bowel diary for usually a few days, sometimes a little bit longer. not because I don't believe my patients, but because sometimes what we think that we are doing in terms of our habits and things versus when we write them down can sometimes provide additional insight, or we might start to notice patterns with certain things. So sometimes that can be another helpful resource to just kind of like look at those things a little bit more clearly and go, do I see a pattern here that might be a clue of what I need to go look at further? Other things that can sometimes pop up with this too is saying, hey, are we considering, are we getting some good movement in through the week? That plays a really big role in our gut motility and health as well. Do we have other medications that we might be on that might be impacting our GI function? Sometimes some of those side effects are things that we need to explore and look at. I'm not saying we should automatically stop taking medication, but sometimes some of my patients have been on certain things for a while and they've kind of forgotten that that might be a driver of some of their other symptoms that are popping up. And then also sleep quality. So are we getting good sleep? Because that's where our body does a lot of the good recovering. If that's not happening adequately, then a lot of other systems in our body are going to start to get impacted and let us know. And I find GI health, when sleep is disturbed or other just higher life stressors are occurring, I can sometimes see this as another piece that kind of can be driving some of those other downstream effects. So giving a little bit of insight of where else I would be curious, in addition to, like you said, it sounds like you've been doing some good stuff with your GI health, maybe tracking it a little bit. If you haven't done that more specifically, might be able to give you some insight. I also will usually, are you someone who's still menstruating right now or no?
Yes.
Okay. So this is another thing too. Sometimes my patients will notice different things at certain times of the month. So not just your bleeding days, but tracking a little bit in terms of saying, hey, do I start to see a cyclical pattern where my hormones are changing throughout the month? That can then also start to help you get more curious than with a gynecologist and whatnot, that it's more hormone forward to kind of be looking at some of these things too.
Okay.
Yeah.
Cool. And is gyno where you would point for hormone issues, or is there anyone else you would recommend for hormonal?
Yeah, so it's a piece. So gynecology, urogynecology is another one too. Sometimes still needing to look also kind of functional health around that. I know that's kind of a buzzword right now. Not all gynecologists, urogynecologists get training in hormone health, as wild as that sounds. That's still an advanced specialty afterwards. No knock on the physicians. This is a bigger issue in terms of the education and medical school training that, what's being taught. It kind of goes up to basically helping people to deliver the baby. And then after that, there's a lot to be desired in terms of the standard of education. So the providers that I personally work with and whatnot, I've done a lot in my area to figure out who's chosen to do advanced specialties on this, who's better hormone informed, who knows how to kind of be able to navigate these things with, more thoughtfulness than just sometimes the average gynecologist. So when you are calling or seeking out appointments or care in these different ways, I encourage you to ask the front desk, hey, do your providers do these things? Do they know how to explore hormone health? What does that kind of look like and whatnot, so you can get an idea to see if that feels like a good fit for you. Or, like you said, I was already planning on reconnecting with my pelvic floor PT. Ask them. We usually know who to go see. So we can also then help point you in some helpful directions in terms of that, so you don't have to try to figure it out all on your own. So that can be another way to be able to build your healthcare team. Cool.
Perfect. Very helpful. Thank you.
Yeah, you're so welcome.
I did find the term. I don't know if it matters or not.
Oh, sure. Go for it. What is it?
I don't know if you've ever heard of it. It sounds very you might not have. I don't know. But it's abdominal phrenic dystergia.
Yeah.
So,
Yep.
Dystergia of the abdominal wall.
Yep. Dyssynergia is just a fancy word for saying kind of out of order, right? And those kinds of things. And basically that's just the fancy medical term for saying, yep, we have bloating that's kind of hard for us to explain. We don't really know why.
Okay. So it's basically what I know is going on, but
we're still going what's the root cause and what's the driver, right? Totally. Yeah.
It's not necessarily going to be root cause, so.
Yep. We got to keep digging, which is what you're doing. Yep.
Cool.
Awesome. Thanks so much for calling,
Perfect.
Kristen. Wishing you all the best as you continue to be a good detective.
Yes, I appreciate it.
You're welcome. Take care.
Right.
All right. One last piece that I kind of want to wrap up today with that kind of ties in with what we started with, and also, considering the pelvic health as whole body health. It is not just important for your pelvis, but it is important for your entire body to feel good and to function well. So another question through email that I received was from Roland, and he asked, can you please describe and explain how to do some pelvic floor exercises for men? I'm a 51-year-old male and want to know what I can do to stay strong and healthy in that regard. And we also had another question down in the chat box that got sent in with a similar, theme. So once again, to kind of recap, love that people want to be proactive about their pelvic health, guys and girls included, all right, because we all have one. Kegels, if done effectively and correctly, are helpful to be able to strengthen that area, and we also need to be doing full body strengthening in order for everybody to be functioning well. So Kegels are just one piece within the larger toolbox of strengthening, okay? Working on your breathing and how you're breathing through your diaphragm. I can't tell you how many times I'm teaching people how to breathe in my office. It's basically every single day, because so many people are breathing up and lifting their shoulders. They're breathing just straight out through their abdomen. They're not breathing 360 degrees around their rib cage. And if we're not breathing well here, A, you can't get good air in. That's important. B, you're going to be unable to sequence that whole core team well. Remember, your core team involves your diaphragm, your abdominal muscles, your pelvic floor, and your spine muscles. We need that core team to function well for you to be able to do life and do all the adventures and everything that you want to do well, including your pelvic floor being able to hold everything while you don't want to go to the bathroom, and then also be able to help you relieve yourself when you do. Okay, so breathing is essential, not just for respiration, but for your pelvic health and your core team. So learning how to breathe when you are exercising, as hard as that can be sometimes, is something that I would encourage you to start to get curious about when you're in the gym. Notice when your body wants to hold its breath automatically. Invite breathing to come in and see how your body changes its movement and its coordination. Your core work will get better. Your core will get stronger if you prioritize breathing better through those exercises versus holding your breath, okay? The other big pieces I'm often encouraging my patients and incorporating into their strength work. I love side planks and different variations of side planks because, again, hip, abdominal muscles, spine muscles, breathing, all of that is starting to hit a lot of good boxes for your pelvic floor, but your overall strength. I also really like Copenhagen planks. If you don't know what that is, Google it. Copenhagen planks are awesome, and they are hard in the sense that they are a type of plank that also really focuses on inner thigh strengthening. Inner thigh strength is essential for a strong pelvic floor as well, all right? And then the other big exercises that I'm always going over, squats, lunges, and also working on those big muscle groups around your pelvis. Because if you can squat well and lunge well, then your pelvic floor can work a lot better too. So these are other big activities and exercises that you want to continue to practice and get good at, because it's not just helpful for life, but it's also helpful for your pelvic floor. If you have hips that are strong and moving well, then your pelvic floor has a much better teammate to work with, okay? And being able to squat and lunge well is essential for being able to maintain independence as an adult. We cannot get in and out of bed without a squat. We cannot get on and off the toilet without a squat. We also can't get in and out of a car or a chair without it. So maintaining and working on that is really important for so many things. So when people ask me, what's my favorite pelvic floor exercise? They're shocked when I go, squats and lunges, done well, and breathing while you do it, because it hits all of those things. All right? So thank you for joining me today for our third episode of the Dr. PT podcast. I want to encourage you all to continue to meet me here every Monday from 2 to 3 Pacific. And also, if you are a little shy and want to ask your questions via email, you can also do that at askme@drptpodcast.com. And I will still encourage you to get brave one of these days and give me a call instead so that I can further unpack your questions with you. And I look forward to catching you all next week. Continue to move well and move often.